Hi everyone, this is the chapter on assessing. Just a reminder to go over the key terms at the beginning of the chapter as well as the NCLEX questions and rationales at the end of the chapter, and make sure to listen to this recording more than once to synthesize your learning. Here are the learning objectives for this chapter. Please take a moment to review each one of these. If you can speak to these and apply these to your nursing practice, then you have accomplished your learning for this chapter. Assessment. This assessment chapter is going to be huge, you guys. Actually, the next 5 chapters, we're discussing the nursing process, and ADPI is going to be huge. So make sure you're taking really good notes because we definitely will be using and doing a lot of this every single day with every single patient, okay? Okay, the assessment phase is the first phase in the nursing process. Assessment is basically the collection, the clustering, validation, recording of data, all of that regarding your patient. You need to have facts and information before you can start to formulate a plan of care. The initial assessment forms a database for the nurse to work off of. From here, the nurse makes judgments regarding the patient's health status and ability for them to care for themselves, right? Then we plan and deliver patient care and then make any necessary referrals for community services or, social work referrals, maybe chaplain referrals and those kinds of things. The nurse continues to assess the patient with every interaction to make determinations if the patient is improving or if the patient needs further intervention. So this is something we do throughout the day. We're continually reassessing our plan of care and adjusting that, right, and beginning new plans of care if new problems arise. While assessing, you apply many critical thinking skills and make judgments based on the data. Those activities are listed on this slide. Please pause and take a moment to review them. Your nursing assessment should have several priorities to it. It needs to be, you need to have a certain purpose and a certain goal in mind. You also need to get the most information you can up front, right? First, before you ever go down that pathway of trying to determine what the patient's needs are, right? You need to make sure that you get all the information you need to come to the correct conclusions regarding the patient's current status and their deficiencies, right? It needs to be organized. It needs to be systematic. You only have to work with factual and correct information by verifying what you are hearing from the patient, the family members, friends, and so forth, and what you're also observing, right? The data needs to be relevant to the patient's care needs, and it needs to be recorded properly. And we're going to teach you how to record properly. So not only to ensure your patients are cared for and covered correctly, but also to ensure you're not, litigiously, litigated against in the future, right? Okay, this slide reveals the differences between a medical assessment and a nursing assessment. We focus on the whole patient and the responses to the illness, while the medical assessments focus simply on the illness. So I'm going to be honest with you, this is going to be a little bit challenging in the beginning as a new student nurse to try to get your mind to think and recognize a medical diagnosis or a nursing diagnosis. They're completely different, right? Again, the medical diagnoses focus simply on what is the acute or chronic disease process that's occurring with a patient, right? That's their sole purpose. Whereas we are focusing not only on, on aspect of that piece, but more importantly on the whole patient, right? How are they responding to that illness? Is it causing additional physical limitations that we're going to have to get other people on board like PT and OT and all those kinds of things, right? Is it causing anxiety? Is it causing all these things, right? That we as the nurse, that's our focus. So you can see the difference between the two, and it's very important, and you will have test questions on this and on your licensure exam about that. There are 5 main types of nursing assessments that are performed, right? So we have your initial assessment, then you have your comprehensive assessment, then we have what's called focused assessments, emergency assessments, and then we have time-lapsed assessments. There's also a patient-centered assessment method called PCAM that we do as well, right? We're going to delve deeper into these later on in this PowerPoint. So up in the upcoming slides. Remember, the primary source of information is your patient. When in the assessing phase, the nurse will prepare to gather data, collect the data. We will identify cues from that data, and we will make inferences based on that information and our lifelong experience and education. We are then going to cluster the data in a meaningful way. And then we'll look at that data in a meaningful way and then identify patterns that we see. And then, of course, we're going to record, report, and then get further direction on, our interventions and nursing interventions as well as medical interventions like medications and things like that. The initial assessment is performed shortly after the patient is admitted to the healthcare agency or service, wherever they happen to be at, right? So you do initial assessments in every format, whether it's hospice units or in the patient's homes or at SNFs, ALFs, hospitals, all of that, right? You're going to do your initial assessment. So there is usually a set time frame that is established that the initial assessment must be completed in, right? So we have certain time frames, and each organization will be a little bit different as what within certain time frames you need to do that initial assessment and documentation of that, right? The nurse collects a complete assessment to establish a database to work off of, right? So this is we're going to get as much information as we can, right? Good patient baseline information. And let me say that one more time because it's so important. You have to have good, solid baseline information on your patient, right? Because, for example, everybody knows, a normal healthy blood pressure, the new values is anything below your systolic 120 and anything below your diastolic 80, right? So we know that if a patient has a blood pressure of 119 over 79, they're healthy, right? But guess what? Not all patients' blood pressures, when they're healthy, are around that number, right? For example, my mom, she's elderly, right? And so as we age, our blood pressure tends to go up a little bit, but ironically for her, her baseline has always been low, right? So if I, as a nurse, assumed when I took her blood pressure, and my mom's usually around 90 over 45, maybe 50, right? So the nurse might assume that maybe the patient's going into shock, right? Where your blood pressure starts to drop toward the end of sepsis, when patients start to go into shock, or something else, right? There might be a complication. So if we don't ask those baseline questions, then we'll be making assumptions on information that is not true. Okay, so it's so critically important. The chapter in your textbook has really good examples of a handwritten admission or initial assessment. So please, if you don't have your book open, which I had stated before, I recommend you have your book open when you're going through listening to our recorded PowerPoint so you can take notes, right? Look at that. Take a look at it and see what it contains, right? Does it paint a good picture of what's going on with your patient? If that's all the information you had to go off of, could you care for your patient, right? So it's critically important you can see how our initial assessments, all of our assessments, need to be thoroughly documented, right? Could you start to formulate a plan of care with the information that's been given? And this is the goal of any initial assessment, right? Focus assessments gather data regarding a specific problem that has already been identified. Your textbook, again, lists some really good examples when performing a focused assessment. So please, again, look at your textbook now. So pause the video and look through your textbook at those examples, right? I'm going to tell you again, I think I've already mentioned it, but if I haven't, we do mention this quite a bit. Your exam questions here in nursing school for all 4 blocks, as well as your NCLEX licensure exam, is going to almost always have the information that we are testing you on in a patient format, in a patient-centered format question. So almost every question you're going to get is going to be, a patient presents with, these things, and what is your primary intervention, or what is your so looking in the book. The reason I tell you this, why do I tell you this? Because when I say look in your book, it's because they have already those type of examples in your book. And because our test and the NCLEX licensure exam is going to be just like that. You want to start training your brain to start thinking about what that looks like in a patient. If a patient has chronic bronchitis with lots of mucus, what does that look like in my patient, right? They may get, you know, they may get blue tintish color to their skin because that mucus is in the alveoli and in the airways, and it's blocking the exchange of oxygen, right? So over time, they get oxygen deprived, right? Things like that. So you want to start making those connections now. Quick priority assessments, right? They're really short, focused priority assessments, right? To gain the most information that you need right then and there, right? So that you can make a decision, flag any kind of existing problems or risks for problems and those kinds of things. Emergency assessments are done when there is a physiological or psychological crisis, and you need to identify what is the life-threatening problem that's currently in front of you, okay? So, I mean, this is really quick, right? So we're talking, when we, you need to start prioritizing patient care, start learning how to prioritize patient care, because you prioritize your start of day and then you reprioritize every half hour to hour, right? And you adjust your patients on your floor in your plan of care based on how your patients are either getting better or getting worse. So again, you're going to start with airway is always number one, right? Or I shouldn't say always. Typically number one, right? Sometimes circulation you'll learn in block 4, and not until block 4 circulation can precede airway in a few situations. But airway is, we typically start with airway, then breathing, and then circulation, right? So those ABCs. And then next is Maslow's hierarchy of needs. And it starts with the base level of food, shelter, safety, those kinds of things, right? So that's how you're going to start prioritizing patient care in your brain, and you're going to start critically thinking how you are going to place them. And I want you to start doing that on day one. When we do case studies in class, when we do NCLEX questions, when we do all of that, I want you to start prioritizing. Writing it down in the beginning is probably a good idea, and prioritize based on that, right? So I get it. Emergency assessments are for life-threatening situations. So now we have time-lapsed assessments. They're done to compare a patient's current status to their baseline data information that you obtained earlier, right? And then make any necessary changes to the plan of care based on whatever's happening with your patient. An example would be someone diagnosed, let's say, with hypertension, they're put on meds, and then comes back in periodically to have their blood pressure checked and evaluated, and the meds adjusted if they're not effective, or maybe they're too strong. Maybe it's making the blood pressure tank, right? Or maybe there's other interventions that need to be met. So that's what those are. So our triage assessments, we do these all the time, right? So that we can determine exactly, it's a screening tool to determine the extent of the severity of what's happening with your patient right at that time, right? And then based on that determination of the severity, we can then make an educated decision on where to appropriately have them go for follow-up. So for example, at Hospice of the Valley, we have a contract with Honor Health, and we provide triage calls in a system for anybody who's been in the hospital, gone in for surgery, any of that, right? And been discharged home. They give them the Honor Health transition line, which I answer those calls, right? And that is exactly what I'm doing. I'm literally triaging these calls when the patient calls in and they tell me what's going on with them. I have to assess and determine if is this a stat 911 to the hospital kind of thing, like hang up and call 911. The patient was in the hospital post-op, and now they're home, and all of a sudden they became severe shortness of breath and chest pains, and post-op, I know as a nurse, DVTs that could dislodge and go to the lungs is a real could happen. It's a reality, right? Tissue is time. So if I don't advise them to hang up and call 911, that patient could be dead very shortly, right? So, or is it simply They had surgery and they forgot that during part of the pre-op instructions as well as post-op that there would be swelling in the area as well as in the limb that is, distal to the surgical site, right? So they freak out on day 3 when the swelling is, pretty significant. Then I just have to educate them, right, on the process of inflammation in the body and what happens when we go in and, damage the skin because we need to cut in or, surgically go into the body to do what we need to do to fix them, right? You have to explain that whole process of white blood cells going to the injured area and inflammation and, the fluid buildup and all that, right? So a lot of education. The patient-centered assessment method is a tool to look at the patient's complexity regarding their current health and response to illness by assessing and looking deeper into the components that may affect their health. These include their lifestyle and behaviors, maybe social environment, like maybe networks, housing, employment, health literacy, and even maybe just simply their ability to communicate effectively, right? How much can they understand or already know regarding their health and condition? These factors can play a large role in how a patient responds to their condition, to their treatment of their condition, and their recovery, and also after the recovery, right, to maintain their health. Your text has the components of these assessments and has some really good examples in there. So please take a moment, pause the video, and look at your book that has those examples. You also need to prioritize your assessment, right? We talked about this in detail. You need to prioritize your assessment data to get the information necessary to develop that patient plan of care, right? The purpose of the assessment is literally to guide the nurse on what type of data and the amount of data that is needed. Health-oriented data collection focuses on what the patient sees as their behaviors, habits, beliefs, health risks, all of the things that influence their level of health. Developmental stage is important in pediatric assessments because we're continually assessing with our peds patient their independence and functioning levels, right? And seeing where they're at based on those thresholds that they should meet. Culture plays a role in your interactions with your patients. You need to be culturally aware of practices from different cultures, and you need to respect those. That way, therefore, we're going to teach you all about the different cultures in Block 1, and that information is on NCLEX, right? And so there's going to be a lot of information you learn in Block 1 that you're going to need to review before taking your licensure exam. The duration of the nurse's interactions with the patients and the nature of nursing care needed will also determine the extent of data the nurse will need to collect from the patient, right? There are 2 types of data that can be collected. We had subjective data that's collected, and we have objective data that's collected. Objective data is data that is observable by the nurse and is measurable. Things like vital signs, breath sounds, moisture on the skin. Those are all objective data. Subjective data is information that only the patient can perceive and report to you. Things like, pain, nausea, nervousness. Those are some examples of subjective data, right? Data comes from many resources. The patient is usually the primary source of data and is usually accurate, but may slightly be skewed if the patient's in pain or anxious or has some, maybe some dementia or some neurological problems, right? Or they can just have an acute illness and have delirium, right, where they neurologically aren't currently making the connections from the delirium and therefore, aren't really the best of resources or the most accurate at that time based on what's happening in their bodies, right? Family members and caregivers are secondary and friends too, are secondary sources of information, but make sure that the patient does not object to them offering the information. It's very critically important, right? So if they're of sound mind, you cannot talk to family and friends without their permission. And assure everyone involved that their information will be kept confidential and limited to the healthcare team caring for that patient. Patient records are referred to by nurses usually before the first patient interaction. So we'll usually review the record. So again, when you get report on the floor, the very first thing you do before you ever open a chart is after getting report, you literally will go back through and say hi again to all of your patients, right? Because we do bedside report now. So you'll get official report with the nurse leaving, the overnight shift, or if you're on overnights from the day shift. And so you'll do that at the bedside in front of the patients. But it takes a while, right? So when you get done with your fifth or sixth patient, however many patients you're assigned that day, you need to go back before you open your charting to make sure they're all alive and doing fine, okay? And then you can open your chart and then start reviewing the patient information, right? Let's see. Patients, these records and patients can give really pertinent information like health histories, previous exams that have been done, consultations, medications, lab values, diagnostic results. The list is long, right? The healthcare team can also communicate pertinent patient data that they have collected to add to the nurse's information, right? When we have CNAs, PCT, OT, all those guys, wound care, adding continuously to our charting, right? Just to provide more information, more in-depth documentation, which of course will only improve patient outcomes. The nurse may also have to consult reference material, we do it all the time, or research data regarding disease processes, cultures, any kind, maybe even meds or care needs, right? If you don't know, I guess what I'm trying to say is don't guess ever. You look it up, right? This is people's lives that you're dealing with. So you never want to guess. And there will be times where you're down to a 50-50 because you've dealt with the situation before, but I'm telling you, please always look it up before you take action. It's so important as a nurse to get the correct and complete information and make the right decisions. The nursing history and physical assessment are the primary components of data collection. Observation is an integral part of the nursing history, physical assessment, and ongoing assessments. You are interpreting the patient's responses to questions and their situations or their response to physical touch. To what extent can they take care of themselves, right? You're looking at that. Is there anything in the environment that poses a safety risk for your patient? Definitely looking at that, right? All of these things so important, right? Are there any odors in the room? Who's in the room with the patient? These are all things you need to observe, investigate, and take action if necessary. The nursing history reflects the integral aspects of the patient to identify their strengths, weaknesses, health risks, environmental factors, and typically hereditary tendencies too. Nursing histories need to include several components. These include the basic demographics, reasons they're seeking care. We need to include their health habits, diet, cultural considerations, religious considerations, their current state of functioning. Are they having any pain? What is their past medical history? What is their past surgical history? Do they have any allergies to meds, foods, or dyes, or latex? What's their current medication list? Are they using any over-the-counter herbal supplements or vitamins and those kinds of things? Because remember, herbal supplements can interfere or even potentiate, meaning make it stronger, medications, right? We need to know all of that. We need to know the patient's perception of their own health status. What about how's their family history, their psychosocial history, their education level, their ability and their willingness to learn, and participate in their plan of care? How about existence of advanced directives, personal resources or support, and potential for injury? You can see how thoroughly the documentation is that nurses get, right? An interview is a planned communication with your patient. Several conditions need to occur to have a caring, successful interview. We're going to go into depth with communication this block. And you will be surprised because a lot of people think they don't need help in how to communicate, right? But as you will see in class when we do the activities, it'll be fun and interesting, but you'll learn a lot, right? And you'll learn how to successfully have those caring interviews They include, establishing rapport with your patient, which is key, right? They need to learn to trust us. You need to display active listening skills, ask the appropriate questions. You need to have really good observation skills, and you need to follow through, right? So good termination with a plan of care. Um, so go to your text, and again, there is information in there on how to perform or promote a caring interview with your patient. So please look at that, pause the video, and read through that. It's very, very important. It goes through the detailed guidelines for conducting a good interview with your patient. Um, and then also in your textbook, it talks about what can negatively influence a patient's interview. And again, these things are going to be on NCLEX and on our exam. So please pause, go and review that so that you can take ample notes and have that information, right? And you'll notice when you look at the book, it'll have things like, what's the patient's level anxiety? Definitely will impede or affect communication, right? Pain level. If someone's pain isn't managed, don't plan your education or answering questions about processes and things like that during this time, because they're not going to hear you, right? They're in pain. You need to medicate them and come back 15 minutes when it has time to take effect, right? If it's IV, and 30 if it's PO. What about language difficulties, right? Those things definitely impede communication. Previous negative experiences with hospitals or doctors or nurses and things like that, right? Or many times patients have really unrealistic expectations, right? And so knowing that can help navigate those conversations. And again, we'll teach you how to do that. You need to be prepared, have a plan prior to the interview, and you really need to set the stage at the beginning. It is so key to having a successful interaction with your patients, right? Good planning, active listening, appropriate timing, appropriate questions, astute observation. They're all key and essential to the process itself. The skill of nursing observation. I can't tell you how critically important this is, right? And this is something that you learn in nursing school, right? And you fine tune as you begin to work in the field and become, move from that novice nursing role and advancing on up, right? So you get better with your nursing observation, which just improves completely has a direct correlation with your patient outcomes. So again, you're determining the patient's current physical and emotional responses to the situation, right? You're determining your patient's current ability to manage their own care, right? Because that will help you guide on whether at discharge, they're going to be able to go home. They're going to need to go to a SNF, what that looks like, right? You're determining the immediate environment and the patient's safety, right? We're always looking at how to be a safe, competent nurse. And finally, determining the larger environment, meaning, are we looking at the hospital? Are we looking at community? Are we looking at both? Are we looking at free community resources once discharged from the hospital? All of those things, right? And the observations you do in the hospital and in the community, or like when you're in the home as a hospice nurse or a home care nurse, or, these are things you are going to be evaluating, right? The larger environment. Nursing history captures and records the uniqueness of the patient and includes the reason for them seeking their care, right? Their usual health habits, any cultural considerations, their current state of health, all current medications, allergies to foods, perception of their health status, developmental stage, family environment, psychosocial history, what the patient expects from us, as their nursing and as their supportive advocate, our educational needs, their personal resources, any potential for injury. And this, of course, is done by literally reviewing and interviewing with your patient, right? Asking those questions. The physical assessment usually occurs after the interview, and it is, of course, that's where you start establishing that rapport and building your trust with your patient. The purpose is to get the patient's health care status, identify any problems, and establish a baseline, right? We will be teaching you how to perform a head-to-toe assessment in the coming weeks, and trust me, we're going to practice it a lot. And I'm going to recommend again, I know I've said this before, and I will say it again, you need to listen to anybody who will allow you to listen with your stethoscope so you can start building the knowledge to decipher between the different types of breath sounds and heart tones and things like that, right? So assessment method, we have inspection. This is the process of performing deliberate, purposeful observations in a very systematic way, right? Auscultation is the act of listening with a stethoscope to sounds produced within the body. Palpation, use of the senses of touch to assess skin temperature, turgor, texture, moisture, vibrations, all of that, right? Within the body. And then percussion is the act of striking one object against another to produce sound. So we will percuss the abdomen many times. And again, we're going to practice that in lab and clinicals and class. There are also problems that can occur with data collection. For example, failure to plan to get the correct data needed can leave you with an unorganized database, right? Which will be ineffective in caring for your patient. If you don't observe and do active listening while collecting the data, it can leave some important information and data not followed up on and really miss some key areas of patient care, right? So it's critically important, right? If you don't know the purpose of the data collection, you may end up collecting unimportant or irrelevant data. Failure to validate information you collect as you go along can really lead to erroneous, misinterpreted data. Actually, can lead to really negative patient care and even really bad outcomes. Right? Failure to gain trust and establish rapport with your patient prior to data collection can really leave you with less data that you need in the end, right? Because they're not going to share. They're just going to shut down. So you need to establish that rapport when you're doing your head-to-toe assessment, right? If you jump to conclusions, by the way, and don't explore what the patient is telling you, or, I've encountered these signs and symptoms before with this patient with these diseases. And so this is probably X, Y, and Z, and the patient is telling you further information. Don't do that, you guys. Don't do that. Yes, absolutely. It's beneficial that our experience aids in helping our patients, but you always have to keep an open mind and not make judgments like that, right? Let it guide you, but don't let it close you off to that it's the only possible thing. If you assume that the initial assessment is still relevant and further assessments are not done, it can really leave you with an old, possible, irrelevant data and information, and again, can impede patient care and outcomes, right? So make sure you're doing that 100%. There are times when you have to verify the data, right, that you collect. That may occur when what the patient is telling you and what the data you are collecting, they're just not correlating, they're not meshing, or when the data lacks objectivity. Sometimes that there's no objectivity, in this data you've collected in the situation you're hearing from your patient, right? Sometimes maybe it's just simply, it's so fresh for them or maybe they're experiencing a severe anxiety attack, and therefore it's so the data is so not objective, right? So it's subjective and clouded by what's occurring with them, right? So you will need to verify data, right? So when that discrepancy exists, you're going to go back in and you're going to use your wonderful assessment and observation skills to validate or to establish the need to redo further assessments, right? Again, that's done when the data lacks objectivity. There's too much subjective information in there. Subjective information is important, but objective data is equally important, if not more. Actually, it's more. So, but they both help to improve patient outcomes. I don't want you to look at subjective data like it's not important. It is. Validating data is necessary to try to keep the data error-free. So this slide goes over some techniques you can use to make sure your data is valid. Please pause the video, read through them, as you will be doing that. In healthcare data, the data is not good if it cannot be acted upon and documented appropriately, right? So these are things you have to consider as a nurse, right? It's our responsibility as the nurse to immediately report any significant findings in the patient data that you've collected to the appropriate people and the appropriate resources, or at a bare minimum, you need to consult with another colleague like your charge nurse or your supervisor so that you can take action on that to make your patient safe, and not deteriorate, their care, right? This is critical to assure the patient receives the necessary changes in their care. Timely documentation in the medical record is also essential. So once you get that patient safe, then you want to make sure that you record that data in a timely manner, right? So that the database can always be most up to date at the time, so that everybody who's looking in there, whether it's the physician or pharmacy or, lab or, well, it's pharmacy or, no, lab, sorry, lab or, doctors and things like that. They can look and they make decisions on their plan of care for the patient based on current, most accurate patient data, right? Assessment data. Summarize the database concisely and in a manner that is easy to find and interpret. Use only approved abbreviations. Oh my gosh, I cannot tell you this strong enough. When nurses make up their own abbreviations, one, if it's ever called into court, that's not good at all. And two, it really does present safety concerns for your patients. So never ever use non-approved abbreviations. Okay. You definitely want to always use correct grammar, correct spelling, all of that, because again, this is a profession, right? So we need to ensure that we are making sure that we're soundly documenting using the appropriate language, correct spelling, and all of that. So use spell check, people. Do not just type on the chart when you add a note to the charting and not use spell check. It looks so unprofessional, and really it will not present you in a manner that's in a positive light. Okay. You can definitely quote your patient whenever necessary. I like to do that because it is a more accurate record of the situation and what the patient says, right, and what's on their minds. This will help get the subjective data recorded precisely. Avoid vague statements or judgment terms in your charting. I never want to see you say, patient stable, continue to monitor. What are you monitoring? What they order from the cafeteria? Or are you going to monitor, their labs and their blood pressure or their heart rate? Like, exactly what are you monitoring, right? So don't put that, please. And I know there's a million nurses out there doing it, but it isn't right? One of the nurse's primary ethical responsibilities is safeguarding the privacy of our patients' medical information. Nurses must be familiar with the institution's policy on privacy, and as well as the government's HIPAA, right? Health Insurance Portability and Accountability Act. You need to know it. Very, very important, okay? So it provides safety for our patients' healthcare information. They have a right not to share it unless they want to. And so with a few exceptions, like, if somebody were to get TB, because that could be, it could take out an entire population, community, we can share, their information on that without their permission. But outside of those type of situations, it is up to the patient whether or not they're going to share their healthcare information, right? After a complete, thorough, valid, and documented assessment, the next phase is the nursing process, is diagnoses, okay? So we will go into detail about that in the next chapter. So this concludes the chapter on assessing.